Thank you, members of the council. Dr. Sami Areola. I'm the director for the Metro Public Health Department. With me today is Jim Diamond, who is the Bureau Director for our Bureau of Finance and Administration. And now seated with me are several members of our leadership team. And so, they can see you. Thank you. All right. So I started my work here slightly over 3 months ago. Prior to my start, I worked with departments of health in Johnson County, Kansas, and came here from Prince George's County, Maryland, after I spent about 18 years here at the health department. And I would say the 3 months here have been pretty good. Glad to be able to renew a lot of the existing relationships, but also glad to be making new, nurturing new relationships. Change is constant, and health is very broad. And for us, the 600 plus employees that we have, our goal is to protect, to promote, and to sustain the health of everyone that lives, works, or visits Nashville. And we want to do that by creating healthy conditions everywhere. And I know there's going to be a few questions about what's going on at the federal landscape. I would just acknowledge that we have lost 3 grants, totaling a little over $11 million. But again, as I would say later, the mayor's budget has been very helpful in mitigating some of the impacts. A lot of our grants, a lot of our budget, about 60% of our budget are grants, most of them federal through the state. And even without the cuts, we know, based on the trends of certain things, that we have to reinforce and increase some of our efforts around certain conditions that we are seeing. For example, I look at what we have to deal with in 3 buckets. One is some of what I hear from you all the time, which is what I call issues of public health significance, like addressing community violence, like addressing opioid overdose and substance use. And the second bucket, what we have done for years, which is controlling and containing the spread of infectious and communicable diseases like tuberculosis, like sexually transmitted infections, like HIV. And of course, the third bucket is really addressing chronic diseases. I will say that our team, really lots of efforts over the years, and the grants that we get through the state mostly, you will hear about CHANT, you will hear about the TB grant and the STI grant. One of the challenges we've had over the years is these grants have remained pretty flat. And when we give our employees merit increases or cost of living increases and other stuff, they don't always meet, we don't get the corresponding increases in the budget. So we've had those challenges. I will also say that in Nashville, our efforts around TB, which is pretty substantial, and STIs, we are still seeing a trajectory that we would like to reverse. We are seeing increases in the number of new HIV infections. We are seeing increases in TB cases. We are seeing increases in syphilis and congenital syphilis. And I would tell you, you look at our staff and the amount of effort that we put in, and sometimes based on resources, we really have to prioritize, for example, which of the STIs we actually focus on. And so those are trajectories that we are looking at who is impacted, what are the factors that are contributing to that, and what we can change. Again, I got here right when the budget improvement was being submitted. I would have to, as I told him last week, really commend the mayor, really following us through the lost revenue in the rescission of our grants, but also assisting in the things that are important to us moving health forward in Nashville. I also want to acknowledge the support that we have from our finance department, Janine and Co., and from our legal department. We have kept them informed of those losses. And I know one of the questions that I've had here is the impact of losing those funds. And we can talk about the impacts in terms of staff lost. We were lucky to be able to move a lot of staff to other funds. We still had to let 6 staff go. But the bigger impact, though, is on the health of our residents. And the fewer resources that we need to do public health, the higher the risk of people having adverse health outcomes in Nashville. I will say again, 2 things that I say to people. A lot of what we do in public health is preventive, meaning that we're trying to get things not to happen. And quite honestly, it's tough for people to see when what you're doing is to try to prevent HIV from spreading, is to try to prevent TB from spreading. The way to look at public health, it's one of the broadest departments you will see. We do so many things. I'll talk about a few of them, but that's just a fraction of the many things we do to promote health in Nashville. Public health is everything that you do, everything that happens to you before you need to seek clinical care. Think about that. It's what we do collectively as a society to create conditions where everyone can be healthy. We have animal control, we have TB program, we have STI, we have environmental health, which includes restaurant inspections. So when you go to lunch or dinner, you are there not thinking about the safety of the food that you eat because of the work that we do behind the scenes. And that's true when you go to pools and hotels. We have population health programs. I've mentioned Chant and other stuff. You've heard about Nashville Strong Babies, which I will share a few words about. And so in spite of that, again, 60% of our funding has been grant. But people ask me what the impact of the cuts are. Again, in spite of the fact that we are used to working without adequate or even dedicated funding, in spite of not having policies that necessarily support what we do, especially after COVID, our work continues, and we're committed to that. One of the grants that we lost was the COVID immunization grant, for example. And I think we have heard about all the infections of measles going on across the country. What you probably haven't heard also is about the cases of whooping cough, pertussis, that right now compared to last year at this time we had about 4,700 cases. Now we already have about 9,000 cases. And we have an effort around here to ensure that people have access to the right information about vaccinations. And when we talk about preventive upstream factors, that's what we do. And that's why I'm especially appreciative that the mayor's budget reflects correcting and filling the gaps that were created by the loss of those funds. And so we have, for example, what we call the strike team. The strike team's been going around providing physicals to school-age children, making sure they're up to date in their immunization so they can get to school and spend more time in school. Again, we were able to move those staff there to the school nursing fund that we have. So we didn't quite lose those staff, and the mayor's budget, again, was very helpful in ensuring that we can continue those services. One of the, 2 of the positions that were at risk were the immunization records. That's where people come in and get their shot records so their kids can go to school. Again, we're able to move those around. And again, the mayor's budget reflects being able to give those positions back to us so we can continue the important function. School nurses, I mentioned that. For those that were here during the COVID era, you know that our nurses played a huge role. They play so many roles. They are, in schools, ensuring that kids get the care that they need so they can be in classes. And this year, the funds is directly in our budget. More importantly, though, is I knew when I was here before I left, we had the goal of having at least a nurse in every school. It's good to see that the budget is reflecting increases in the number of school nurses so that that goal can be met. Of course, hiring nurses is something that we are working on, so we can utilize, we can fill those positions and meet the needs of our school children. The budget also addressed and provided additional resources for family planning. Again, we want to ensure that people have access to what is needed to determine, for example, the method or birth control method that's available to them. We also make sure that we work with people no matter what their income level is. And so we provide services through what we call a scale, depending on how much the person can afford, but we make sure that people who need the services get them. You also have had the mayor talk about, which is one of my favorite programs also, the Nashville Strong Babies program. And when that program started, it was based on, and we've been working on that for several years, trying to ensure that in a society that's the richest country in the world, that we have birth outcomes and that is commensurate with what we have to be as a community. You know, we saw zip codes, for example, where infant mortality rate was very high. And good to see, Diana Allen is in there. Good to see that this effort, this targeted effort, has shown over the years that it's a very, very impactful program. We have seen 9% reduction in infant mortality in these 7 zip codes. And that's the good news. The concern and the anxiety that we have for programs that's that impactful is that the leaked HHS budget, yes, ma'am? Okay. All right, okay. All right. Is that the leaked document as well as the skinny budget that we got did show that these Healthy Start programs could be at risk. I know definitively that that's one program that Nashville cannot afford to not continue. It's impactful, it works, and that's been demonstrated in the last few years. And along that line also, not only are we speaking with the mayor's office, we are also speaking with the state and looking at all the options that may be available to us if that indeed happen. I also know that there's been several conversations around our behavioral health program. That is the community violence piece. And really for us, public health is emphasizing public health. It is, there's a lot of things that impact public health that are outside the purview of the health department. So it's an imperative for us to work with our partners and the community safety funds. And we have a team here. I think the last ones, we finally were able to get them out, or in the final stages of getting them out. There's been several hours and effort that our staff has spent on that. And since I've been here, I've met with several of those organizations, really emphasizing that we're here to work with them. And we appreciate what they do, but pretty happy to say that we're getting that out. And there's several other conversations that we're having around preventing community violence. And I have personally seen some data and talked to some of those community members that are doing some of the work, and really happy at where things are heading in terms of addressing community violence. The other thing that we are also in that area is talking about opiate and substance use. And you will see that in Nashville, the data is trending down. And that is true across the country. And that's a testament to public health efforts. It's been several few years where public health has really been on educating and working with law enforcement and working with fire EMS to ensure that we are using data to drive our decisions and interventions, using data work with law enforcement to know when new shipments are in town, where they are. And again, at the heart of what we do is data. It is making sure that we have access to those data to inform our activities, making sure that we use data to know who is impacted, use data to direct our educational and outreach activities. And it's a win, I think, for public health to see that across the country that metrics of opioid overdose are beginning to trend down because of public health efforts there. The last piece in our behavioral health program is just around mental health resources in general. And I've had more meetings with our behavioral health team, Dr. Harris and Dr. Ann, than with any other groups since I've been here. Because again, it's very, very important. We are so comfortable talking about somatic health, not as comfortable talking about behavioral health. And we want to make sure we remove the stigma. We also want to make sure that we identify the gaps in resources that we have in the county. No question about it. It's a big gap in terms of availability of providers in the county. For different reasons, we have met with some of our health plans. We've met with some of our health systems and FQHCs, and continue to try to understand that, especially our Black and brown community here do not have access to providers. If you're trying to get a therapist, you're waiting several weeks, perhaps even months, to get providers. So those are the things that we're working on. Of course, in the interim, because of the availability of grants and other things, we do have some of those direct care at the health department. Not something that it's not the sustainable approach long term, but we do have those resources there. Long term, though, is to have that conversation and decide as a community how we will bridge those gaps in a way that we can sustain. Of course, you've heard about the Partners in Care. We've heard about the REACH program. And those are really evidence-based model. And I look at the data. Those things are working. It's making sure that people get the help that they need and not putting our law enforcement in difficult situations and not criminalizing people that are in crisis. And so I'm working with a mental health cooperative is also an important part. I know in this budget also, again, thanks to the mayor, fire has an improvement request we also did on behalf of Mental Health Co-op, and those are included in the budget. Again, making sure that those services are readily available for our residents that needs them. I also, again, want to talk about Metro Animal Care and Control. I know that I've spoken with quite a few elected officials about that. As with most of what we do in public health, the efforts, we need to put out there a lot of what we do. Our facility is small, number of staff relatively small compared to the size of our county, but the work that our staff do there is really, really impressive. In 2024, for example, we took in 5,257 animals, and that is up by more than 200 compared to 2023, which was 400 more than was taken in 2022. And again, the budget does reflect the mayor giving us additional animal control officers in the facility, and we continue to work on a new facility for MAC, as well as a replacement facility for Woodbine. And as I said earlier on, health is broad. The range of programs that we do is very broad. You will hardly find any other department that does the different things that we do across the county and the depth of activities that we go into to ensure that we create conditions where everyone has the opportunity to be as healthy as they possibly can. And I know that I've met with some of you, and I look forward to meet with those that I haven't met with. We appreciate the mayor and the finance and the entire team. We appreciate your support. Look forward to working with you. I look forward to talking through your concerns. I look forward to collaborating with you as we work with the community to improve the health of our residents. And I'm happy to take questions that you may have. Thank you.
Thank you so very much. Director Ariola, this was very informative and we appreciate all the information. Thank you what you do for Nashville and for our residents and constituents. And Nashville is very lucky to have you. So we're very grateful that you chose to come back here and to continue to serve us. I really appreciate what you said about removing the stigma around mental health, as that is very important. Also talking about access for our Black and brown residents to therapists, as that is a need across the country. And I'm sure hearing about the new facility for MAC just made Councilmember Bradford's heart grow 3 sizes. So thank you for including that. Before we get started with the questions, I did have one clarifying question. Is there a budget ask? Because one part of what we're trying to figure out is, did the mayor fully fund the budget that you all have? And if not, what are the additional things that you all are asking? And in the budget questionnaire, question 3B, it's basically asking that question, and it says, please see attachment A, but unfortunately, it does not appear that we have attachment A printed for us, so we don't, the members that are here right now can't see what that ask is, so if you all could just share that, that will be helpful for the context of the remainder of the conversation.
All right. I'm going to start, then I'll let Jim come in. Again, when I first got here and the improvement requests were made, I literally just got here, but that was before those things started happening at the federal level. As I've said, we have kept the mayor's office informed, and we are in constant conversation with them. And really what's impressive to me was meeting some of our earlier requests, but also adjusting and meeting some of the gaps that were created by the loss in federal funding. To your particular question, I know that in some, we probably got fewer positions, maybe for like animal control, for example. But again, there are additional steps that we have taken internally to ensure that we are addressing some of those needs. For example, the Metro Board of Health just approved salary adjustment for some of our ACOs, some of the high turnover positions in Metro Animal Care and Control. We're not. We do have a few open positions there. Of course, because we have open positions and maybe inadequate persons there, we are probably having people do a little bit more overtime than we would like. But so when we get these positions, we also want to make sure that we can fill them. So I think a combination of the positions and the adjustment that we have made to the pay scale, I think will be very, very helpful. So that's that. But I'm happy to resend those to you. And Jim just gave me some of those. Even when we submitted those, some of the what we submitted were for grants that are not ending in this fiscal year, that are ending in the next fiscal year. Again, overall, pretty happy at the improvements that we got. Really, especially those that they have to adjust that they didn't plan for. And that's quite a lot. But we are happy with the improvements that we got.
Thank you. So to be clear, is there an amount that you all are asking the council to supplement that has not been funded in the mayor's budget? Or are you all saying we're happy with what we have and we're not asking for more? We just need to know for clarity for council members as we think through the substitute budget.
So I don't think we are asking. About the only thing that you can consider is maybe additional animal care and control officer. If that's feasible, if it's not, we're pretty happy where we are.
Okay, thank you. Councilmember Evans, I'll start with you if you have any questions. You're recognized.
Yes, ma'am, thank you. It looks like page 409, there's a reference for mental health co-op for $302,400. And it looks like that's the REACH expansion.
That is the REACH expansion. It looks like, so the two additional resources for fire, this is matching that with the therapist, but I'm sure there's probably some adjustment that needs to be made to that figure. Yeah.
Oh, okay. And then on the on page 414, and There's the information, broken out by fund. So like there's the community safety fund and then like the opioid settlement fund. And so on the community safety fund, I think one of the things that I still feel challenged with, and I think it's more just like continuing to kind of make connections from like last year to this year, or now you being here and under your leadership, like we had, some discussions kind of around providers and who is, providing those support services in the community. And that's kind of come back up again related to our conversation that we had last week, with immigration enforcement and like the community safety discussion and that kind of thing. And so one of the aspects that I had looked at related to, or we had looked at related to budget, but then also just process, was really about how to kind of tell better stories related to the providers that were participating with the health department to be able to provide these services in the community. Because I think if you don't work with the provider, you don't necessarily know what they do. And so it's like, how are we providing these feedback loops? And so I'm speaking this into the world because I think it's an important kind of connection from last budget to this budget, also in light of this immigration discussion around how we're kind of elevating the work they're doing, making sure every member is aware of the work that they're doing. And so I have no issues kind of related to the safety fund other than like just thinking through how are we going to tell their stories more, and not just in the context of like behavioral health as a whole, but really focusing on that specific issue because it resonated so much, I think, last week. And then on the opioid settlements, I guess it really didn't sink in or hasn't sunk in before. I didn't realize that we were funding 22 positions out of opioid settlement money. And so that's all is that the therapists that we had kind of talked about in those services, or are there other things that I just don't know about that we're funding out of that fund?
Right. So the first part of your comment, now we have all the resources out for the community safety, and really proud of our team. It took a lot of effort to navigate the system and get the funds out, but also to get the providers to have measurable metrics, to have the right metrics. There is what we're going to do, and there's what we're going to track that. So we'll be able to tell that story. And some of them are already doing a lot of work, but getting the money out and being able to see the impact of what they're doing, I suspect next year will be the starting point where we're able to do that. Some of them are just now getting the funds, but that's noted. We'll be able to track those stories. The second part about the opioid settlement fund, I understand that the current positions there, that some grant ended a while back, and those were programs that were important to the community, and so they were moved here. But moving forward is where we're going. It's a long-term fund that we're expecting. What we want to be sure of is to make sure that those funds are used to build the resilience and the infrastructure that we need to combat opioid overdose, but substance use at large. So we're going to be taking a fresh look at the fund and how to use the fund to do that, especially for me, looking at those upstream protective resilience factors in the community, and more of that and less of directing the funds towards clinical care. So we're working on that, and we'll keep you informed. About the only thing that we're committing to right now is to ensure that we have adequate supply of Narcan in the community and other harm reduction resources. But in the interim, we're working on putting a team together or using some of the teams we currently have to ensure that the settlement funds are used in a way that is sustainable in the county.
Thank you. And then I guess kind of related to that, on the kind of the Narcan side of things, there was earlier over the weekend, there was a resident in my council district who was found lying on the side of the road, and thankfully enough passersby happened to stop by. They thought he was having a heart attack, but it turned out he needed Narcan. Somebody had it. They were able to revive him before the paramedics arrived. And so the social media kind of thread really about that experience. One of the things that was challenging for me is I said, people were talking about how they would get it through their insurance and that kind of thing, the cost of it, getting it at Walgreens, all that jazz. And I'm like, you can go to the health department on Charlotte Avenue and get Narcan. Well, nobody's going to drive from Hermitage to Charlotte unless they really, really have to, because it's the traffic is too extensive. So is there any opportunity to kind of partner with like social services or Office of Homeless Services as far as distribution? And maybe I just don't know that it's being distributed to those sites that are on a closer side of town, or maybe there's other places they can get it through Metro that's not at Charlotte.
Yeah, so the goal for us is to make Narcan available very broadly across the county. The police, I believe, have some Narcan vending machines around downtown area. And what we have done is to provide a Narcan to them. I think recently they requested for 1,000 doses. We made that available. Our staff just had the first vending machine in one of the stores, I believe 7-Eleven recently. The goal is to expand that across the country. That's that piece of harm reduction, making Narcan broadly accessible, to me is a low-hanging fruit. And until we get to where it's broadly available and readily available where they need to be, we have work to be done. That's what we're working towards.
Did you have any other questions, Councilmember Evans? Okay, thank you so very much. Vice Chair Toombs, you're recognized.
Thank you, Chair. I'm just trying to want to understand the funding for the school nurses. So the money needed for the school nurses, that's coming out of the health department's budget?
So until now, the funds go to schools, and then we have an MOU with them, and we get the funds. But now the fund is coming directly to us.
Okay, so in the past, MNPS would have the money. You have an MOU, so MNPS would pay you all for the nurses.
Yeah.
And now you're going to get the money directly into your
Into our
fund,
budget, yeah.
into your budget.
Yeah.
So that won't be a line item for MNPS. Am I understanding that correctly, Chair?
Yes, that is my understanding, and I am going to allow finance to opine on that.
That is correct. So usually we would, as Director Ariola said, we would usually do the MOU and have the money go to MNPS and budget them as a total budget. And now, right now, we're going to be making sure that we do it more strategically to make sure it's going directly to health as part of their base allocation. So going forward, we can actually plan for and budget every single year those nurses in health.
Okay, I got it. Thank you.
Thank you, Vice Chair Toombs. Next, we have Councilmember Johnston. It looks like she may have stepped away. We have Councilmember Allen, and then we'll go to Councilmember Bradford, and then Councilmember Ellis. Councilmember Allen, you're recognized.
Thank you, Madam Chair. Two questions. First, just to follow up on the opioid treatment. I may have tuned out when you said this, but there are several factors to that. One is making sure the Narcan is available. One is prevention. And as I understand it, just from talking with providers, being able for those people who say, man, I nearly died, I need to get over this, I need treatment. Is there money in your budget to try to ensure that there are some treatment options available to grab those people at that moment? Because I've also heard that it passes, and if you don't have it ready, then they just get back on the streets and you need more Narcan for them. So do we have money for treatment as well?
So technically, public health role could include making sure that people have access to care. But in terms of paying for care itself, that's outside of public health role. If you put the opioid settlement money into treatment, that'll go away before you take 2 breaths, just not enough to do that. But if you look at the six goals of opioid response in CDC and White House, the number 1, 2, and number 1, 4, and 6 are public health. Number 5 is access to clinical care. That's not public health. We do want to make sure that people have access to that, making sure that we're working with our hospitals, FQHCs, to make sure people have access to that.
Gotcha.
But if we get into clinical care, it sucks up all the money.
Gotcha. So just making sure the connection is there is
That's
your role.
important.
Okay,
Yeah.
thank you. That's
it. We
it.
do have a grant that's looking at the care access now, but long term, it is ensuring that people have access to those care.
Okay, thank you. That's helpful to understand. And then second, this is really in the weeds. We have a great air pollution control division, and they have in the past done a really detailed annual report that I think sucked up a whole lot of time, and I understand that, but it requires a position, I think, to ensure that that happens. And I'm concerned as federal money or as our EPA decides that air pollution is not a problem anymore and tries to roll back, it would be really helpful to have current data on that. Do you know if that position is funded in case the time becomes available that we can get caught up on those annual reports so that we've got some data to point to and say, we need those EPA standards to stay where they are?
Yeah, so you got into the weeds a little bit more, but I'll get that information and make sure you have
Okay,
access
thank
to
you.
it. So, but I have, you know John very well, who runs our program, been in touch with him. It's now one of those programs where we've lost any of the funds that we have. And quite honestly, we think because of the Clean Air Act and other stuff, that the risk is fairly low about losing that. So we should be able to continue to do that. But I'll get more specific information and get back to you.
Great, thank you.
Thank you.
Thank you so very much. Councilmember Bradford, you're recognized.
Thank you, Chair. Thank y'all for being here. Looking at the at-a-glance page, looking at the year-over-year numbers, starting with 24-25, total expenditures were 99. This coming year, it's 96. When you're looking at revenues, it's 54, and it drops to 41. So you see a drop in expenditures, a drop in revenue, but your total budgeted positions are up. Can you kind of explain how you're able to increase positions, but it looks like your expenditures and revenue has dropped?
I'll let Jim kind of speak to that, but I guess the losses are likely due to the 11 million that we lost in the grants.
Sure. And I don't have, I got the at-a-glance right before I left here, so I'm actually just looking at it for the first time. But we did see the reduction in the grant funds. The school nurse funding was treated as interdepartmental transfer, so that'll be a decrease there. And I'd have to look, but we did add some, as we said, the opioid positions on the opioid settlement funds. So I'd have to take a look to get the specific numbers, but that's where I think those numbers are going down as well as increasing on the position side.
Okay, thank you. Also, there's a position for a health manager position being funded. Do we feel like that's a needed position? Will this position add any efficiency overall to the health department? What's the overall goal for this role?
Yeah, so that position is meant to work with me and public health. The way that we do it is very broad. It does require a lot of collaborations. We have quite a few programs that we have to spend more time on, including addressing community violence, including the opioid that I mentioned. We talked about community engagement. We're actually in the process of building community engagement more around vaccination campaign, where we are working to identify our partners, nurture existing relationships, and build new ones, but also to use that to provide the right information to the public instead of relying on the misinformation, disinformation. When you, for example, have questions about your vaccine, talk to your doctor. I've talked about understanding the behavioral health landscape, knowing what the resources that we have, where the gaps are, and developing interventions to bridge those gaps. So yeah, we have a ton of work to do, and we need more brains and definitely more bodies to do the work.
Okay. I've got one question I'm going to move around because I've got a bunch about Max. So I'm going to save those to the end. What would be the impact if the targeted savings were not added back into this year's budget?
I would just say that, as I said earlier, even coming here, I gave statistics, or at least a picture of where new HIV infection is. I talked about the direction for tuberculosis infection. I talked about syphilis and congenital syphilis. And really for us, with the grant, we lost 6 people. We moved a lot more people around. So for us, it's not necessarily measured around the FTEs that we lose. The measure is on the impact on the health of our residents, and that's already strained. So that is a a small part of that. I did talk about a lot of our grants. I talked about the CHAN grant, which is the Community Health Access and Navigation in Tennessee. I got that funded. And so those grants have been static. And luckily for us, we do have some buffer with grant in aid that we got from the state, but we have had to move things around to ensure that we keep the staff that we have. Of course, a large percentage of our budget is just into paying salary. We don't have a lot of room to grow. So any additional reduction, and when I say will impact health outcome, I'm really putting it mildly. If you really want me to spell it out, what it means is people are going to get sick and some people are going to die. What we do need is more resources, not less resources.
Okay, kind of going around with the grants. I asked this before in some other departments. Are there any state, local, or private grants or corporate like businesses that you've looked into to kind of get grants from those ways to offset what's being lost from the federal level?
Yes, to both sides. I am being very careful about what I share, but we have been in consistent conversation with the state, and we continue to talk to them and looking for areas where they can help us bridge some of those gaps there. But our Board of Health, we're also working with them on sources of funding from grants and private entities. We are in the beginning stages of those, and that includes even approaching 10 Care and other areas to see where we can get additional funds from. So we're doing all those.
Okay. All right, and like I said, the last few questions I have are in regards to animal care control. So there's 2 positions in the budget. It's great. I've been fighting since 2019 to get more staffing. I've seen, a drastic improvement since 2019 in the staffing levels, the just overall mental health of those working there. In the line item, it says that this is to help provide an adequate staffing. Will this be an adequate staffing, or how many more positions? Like, what is the actual number of FTEs for MAC to be fully staffed?
I'm happy to talk to staff and see if there's a number to that, but I think this year the improvement request was for 14 FTE. And I also know that when I first got here, they kind of have like a multi-year strategy. But also one thing to keep in mind is we have to be able to fill open existing positions. We also have to be mindful of the size of the current location and be mindful of some of the equipment that they need to work. So it's not like we're asking for all of what we need in one piece because of those other factors, but it's got to be a multi-year process. We get the staff, we work with general services to get the vehicles and other resources that they need, and hopefully we get a facility that is befitting of the county that we serve, but also the size of animals that we have to deal with.
Okay, a follow-up to a question that the chair had asked as far as your aspirational budget. You said if there was anything that you would ask council would potentially be one more staff for Metro Animal Care Control. Do you know exactly, or if you don't know now, if you can let us know what cost, like how much would that extra FTE be?
I didn't quite say one more. I said if there's anything that I can ask for is additional resources, but I'll talk to staff and answer your question.
Okay. 2 more, Chair. So to your statements about staffing and getting them filled, it has been an issue over the years with the time it takes between someone accepting the job and them starting the job. And I know you've only been here for a few months, but has there been any noticeable improvement or reduction in that time between offer being accepted and the person starting?
I would have to look at that, but I can tell you what we have done. And by the way, one of the good news that we have is we now have a vet that started, and we have improved how we post our positions. There's better communication between Ashley, Animal Care and Control, John Finke, and our HR. We're working towards, my inclination is to say, yes, there's been improvement, but let me ask them to look at those numbers. But our staff knows that filling animal control positions is a priority for us. I did mention about the step that we took to adjust the salary to make it more competitive. That was just approved last week. So we are, again, looking at all of these issues there and understanding that we need to do things differently. And even for the vet position, there were additional steps that we had to take to get the vet here and get them here as quickly as we can. And we'll continue to work to improve the process.
I appreciate that. And my final question, it's about the shelter. So the last budget or budget before, we got money for design and architecture to kind of get that started. And you mentioned that we're kind of moving along, but where exactly are we about getting that new shelter? Because my understanding is the only thing we're waiting for right now is money to actually break ground and start construction. So where are we with that, and what do you have an estimated time frame for when a new shelter would be up and running?
So we, in the past few months, we're actually starting to make a lot of progress. We have very regular meetings with general services. One of the first things that we did, John Finke led that effort, is look at the current facility, but also work to look at what we need. And so we have come up with an estimate of the square footage and all of the other facilities that are needed. Now, general services is taking that and working with the consultant. I understand there are just very few companies who build and understand how animal care facilities work. So there's going to be an RFP where they take what we have put together and they will refine that to make sure it meets the specifications and the needs that we have. And that's the next step. Last time we met was 3 weeks ago. I think we have another meeting coming up next week where we get the update, but that's next. So once that's complete, then the square footage, all of the specifications will be complete. And now the next step is looking for a location to put that in.
Okay, so my understanding is there's already a location identified, but based on what you're saying, like we could feasibly maybe next year see a budget request for a new shelter.
I think that's realistic. Now, the site you are probably referring to, I think ultimately was decided that it will not fit what we need here.
Okay. Yeah. Thanks for that update.
Thank you.
Thank you so much. Councilmember Ellis, you're recognized.
Thank you, Chair, for recognizing me, even though I'm not on the Budget Committee. Dr. Areola, this is my first time meeting you. Pleasure to meet you from Prince George County. If you have any other relatives or folks there that need housing, District 29 is a wonderful place, despite what the data may show. Two questions. One, just pretty back off of Councilmember Bradford's question. Do you know if within the last 2 years, if the MAC facility has gotten you washer and dryer equipment?
It has, and we also bought a new dishwasher and in the process of buying another new dishwasher. So,
awesome.
Yes.
Perfect. My second question, and forgive me for my lack of knowledge because I'm still going through the line items that you all provided. But is there a number or any reflection in you all's budget to account for the increase in tracking the data that the CDC previously, would have done under past administrations, and also the communication to, our residents here about some of the infectious diseases and communication that wouldn't come out from the CDC as it is now?
Right. So we do have a very good, skilled epi group that are able to get data, analyze, and track them. The biggest issue is access to the data that is needed. So a lot of the data that we have to analyze, we either get from the federal government or through the state. And even before what's going on at the federal level, we've had challenges to even getting some of the data from the state. Even some of the data that we collect, but we route to them by statute or by nature of the grant. So I believe that we may need to infuse additional resources, one or person or data analyst or whatever, but we have resources. The challenge is whether we'll have access to those data to analyze.
Got it. And just to make sure, so you have the resources for someone to handle that data, but resources to communicate that information out to the public.
No, we have a lot of members that are doing community work.
Okay.
Now, I will say that our community health worker grant that we lost is impactful in that area, but what I'm saying as a resource is the data itself. So the CDC have authority, they have access to much more data than we would. And so we draw from their data database to get our local data and do either county level or sub-county level analysis. If those data are not available through the CDC, there's nothing we can do. And similarly to the state, even when we are looking at our county-specific data, the state is not always giving us access to those data. When they are reducing what we have access to. So we can analyze the data if we get the data.
Got it. Thank you.
Thank you so very much, Councilmember Ellis. Councilmember Evans, we are going to wrap it up with you, and then I have one final question.
Thank you, Chair. I just actually wanted to go back to my original question because I never really, it didn't process it. I didn't have the answer. So on the Narcan thing, is there any at social services or no?
Right now, I'm not aware of one.
Okay.
I understand the police have a pretty good network of Narcan resources, but only around downtown.
Okay.
We have started providing vending machines, but we've only done one. But our goal is to work with social services, library everywhere to ensure that Narcan is broadly available, but we're not quite there yet.
Okay. And so I guess what is the restriction, I guess, as far as making it broadly available? I understand that it's expensive and, you know, it needs to be kind of managed. Mm-hmm. And that if you go to the health department, you can go up to like where the pharmacy area is and you can get some kind of on that first floor there. But I guess what would be the barrier for it not being at like social services or Office of Homeless Services or like some of these providers that are not health but connected?
Actually, let me take the back. Maybe I will need one of the members because we were getting Narcan broadly from the state and we were pushing Narcan into the community. So if anybody knows whether Narcan, where else we are providing Narcan, feel free to step up. But the state were giving us Narcan. They did say they won't be giving us after a few months. But I'm happy to get information to you as to where those Narcan are. But I will go back to what I say is we do need to do more to ensure that Narcan is broadly available. And if social services wants to work with us to get Narcan where they are, library and other entities, our goal is to use the opioid settlement fund to ensure that Narcan is readily available.
Okay. Okay, cool. Thank you.
Yeah.
Thank you so very much, Chair Evans. And seeing no one else in the queue, I will close us out. I had one question, and this may be more appropriate for finance. So I'm kicking this over to Mr. Pratt. On page 409 of the budget book, it shows that for the school nurse program, for the salary and fringe, the price is the same. So it's going from MNPS to the general fund. The price is the same, but we're getting 7 additional school nurses, which appears to be for the same price. Is that because of the policy when we're giving money to MNPS, we have to allocate more funding for the reserve fund balance? So are we now able to do more because we've moved it from MNPS to our general fund?
Sorry, it's probably a combination of a bunch of things, but yes, a portion, when we transfer or when we allocate funding to MNPS, to the schools fund from the general service fund, we do have to account for the increase in the expenditure there, so we have to account for the fund balance policy increase. But the reason why we can fund this here is because there's more resources, and we fully fund the pay plan, and this is actually a sustainable source where the grant, there may have been other things in the grant funds that were funding portions of operating or something else, but because we fully fund, we fund a good portion of health, and they also have additional funding in other grant funds. We are able to fund more of the general fund FTE for the nurses here and make it a bigger impact.
Okay. Thank you so very much. And Director Ariola, thank you so much for all that you do and for your staff. Thank you all so much for being here. Colleagues, we are going to go ahead and close out our first day. And again, thank you to our council staff who helped with some of our technical issues today. We appreciate you all pulling double duty on that. Colleagues, for tomorrow, if anyone wants to get ahead We will be having fire EMS, that's section E of your budget book, pages 318 to 327. The sheriff's office, section D, pages 290 to 299. And water services, section J, pages 537 to 258. We will see you all, 537 to 258. I believe that's a typo, but we'll get the correct pages for tomorrow. But we will see you all tomorrow. And with that, our meeting is adjourned. Thank you so much for attending or watching.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.